Hi, hello everybody. Myself, Dr. Shyam Sundar Senior Consultant Spine Surgeon at Germanten Hospital. Uh, I'm trained especially in minimally invasive spine surgery and spinal endoscopy from South Korea. I'm working at Germanten Hospital at present, full time. I'm going to speak about the non-surgical management of the spine surgery, especially managing the neck pain and back pain. The non-surgical management of the spine surgery is evolved a lot nowadays. We are doing specialized techniques in managing spine pain, especially in the injection forms like selective nerve root blocks, epidural injections, sacroiliac joint pain blockers, radiofrequency ablation of the facet nerves to relieve the pain, PRP injections into the disc where the disc degeneration is there, and lot of physiotherapy modalities like ultrasonic massage, IFT, and laser therapy, muscle releasing techniques, and there are special techniques where we can release the special group of muscles to relieve the spasm in the muscles, which can give you a good pain relief. And along with these modalities, there are some medications which can give you fast improvement and regeneration of the disc growth. Whatever the degeneration happened, it can regenerate with supplementations. So all these modalities, non-surgical modalities in spine treatment, we are doing regularly at Germanten Hospital, and other surgical modalities, especially the minimally invasive spine surgical techniques, percutaneous fixations, and pain relieving surgical modalities like vertebroplasty, kyphoplasty, percutaneous fixation for the spine fractures, all minimally invasive techniques, including endoscopic spine surgery. Facilities are available at our hospital, and we are giving best results for the patients who are going suffering with spine pain and back pain and neck pain. Welcome to Germanten Hospital for a better treatment and faster improvement. Thank you.